So, good that everyone is hearing. Thank you all for tuning in. Sorry that I am a little bit late. I know I said at 1 p.m., but coincidentally, as soon as it was 1 minute to 1, someone stepped into the office and I had to chat with them a little bit. So I am here now. Share the live, share the live, share the live. I'm trying to provide as much information as possible. A couple people sent in questions. A couple people put questions under the post that I made this morning and so forth. So we're gonna go with some of those questions first. First, let me, thank you all for joining. Let me first say that we recognize that what is happening now, because the coronavirus seems to be spreading quickly, the world was kind of caught by surprise. Now granted, coronavirus is a class of viruses. I don't even know if plural of viruses. Anyway, it's a class that has been there for quite some time. It's a kind of a common cold thing that we've been dealing with throughout. What has happened though is late last year and early this year, they recognize that we have now a new version of it. If you know how a virus works, it can mutate and become something different, evolve into something different. So it seems like that is what happened. Now we have this new version, which is why you hear people talking about novel coronavirus, novel meaning new. So we have this new version of the coronavirus that seems to be attacking people faster than it normally did before. People seem to be getting infected more frequently or quicker than they got infected before. And in addition to that, it seems like those who got infected, a certain class of those people were getting very sick. If you would recognize, yes, we have over 100,000 cases in the world now. Most of it still is in China because of the sheer volume of how large China is. And we have a couple hundred deaths, most of that also still in China. If you look at the data though, it shows that several things are happening. People who are well, who are young, and who are well tend to get sick and get over it quickly with no major issues. That's one thing we see. So, and that is estimated at about 80% of the people who actually get the coronavirus, experience just very mild symptoms. They don't even worry about it. Many of them don't even think about it, and then they just continue with life. There's another group, about 10 to 15%, that get pretty, it's not just mild. So they experience it. They could tell that they're having something is going on, that they're not well. But there is that 5%, that very, very small percentage of people, about 5%, that have gotten significantly ill. They have gotten severe respiratory illnesses. And because respiratory illnesses means you can't breathe, about 5% of those people have died. We've also recognized from looking at the data that those 5%, those people all look basically the same. And when I say look, I mean in terms of their characteristics. Most of them are old, as in over 60 years old. So you start with somebody who is older. Most of them also have have what are known as comorbidities, meaning they have other illnesses. So they have other heart disease, other lung-related issues, other diabetes. They have other illnesses, other diseases that makes their body already quote-unquote weak. So when you add the virus to somebody who already is weaker, those are the people who we see are getting very, very ill and who we see are dying, unfortunately. That also includes people with whose immune system is compromised. So somebody, for example, who has HIV, or who may have done a transplant, and part of the transplant means they have to suppress your immune system. Those people are immune compromised. Those are the people who we are seeing are getting really, really sick and are dying. The average person, most people who come in contact with this disease are not going to die. Most people who come in contact with this disease are going to experience very, very mild symptoms, and they are going to get over it normally, and it's going to be fine for most people. The thing about this disease though, and this is a question that a friend asked me a couple of weeks ago, if it really is so mild, why are we panicking? And the reason that the world seems to be responding in a very panicky kind of way is because for some reason this disease, this infection, this particular virus seems to be infecting more people quicker than the others before. So because it seems to be getting to more people quicker, then it's more likely that more people who are in that category of over 60 have some other infection and so forth. It is likely that those people, more of those people are going to get infected, and more of those people would then get sick and may possibly die. That's one of the reasons the WHO has been pushing, and everyone has been pushing, to have us do what is known as social distancing, which means staying relatively far away from people who may have the virus. What does that mean? If you are normally sitting next to somebody, instead of sitting right next to them, we are suggesting that you sit or you stand at least 6 feet away, at least 3 meters away from the person. Now that is because what we've recognized is that the virus is transmitted from one person over to another person. It is transmitted via droplets, and those droplets come from your mouth or from your nose. So if the person has the virus and they sneeze, I'm sure we've all experienced sneezing and you're feeling the liquids on your hand if you touch your hand while you sneeze. That is what, or the same thing if you blow your nose, you have the liquid that comes out of your nose. That is what the virus is in. And because the virus is in that, if you give yourself enough space, even if somebody sneezes, then there is enough space between you and the person so that the droplets don't get to you. It's also important to note that the virus seems to be living on surfaces for a couple hours. So for example, I am sitting at this desk. If I sneeze and the droplets fall on the table, then the virus would live on the table for a couple hours. That means though that if somebody comes to my desk and touches the table with their bare hands, the virus is now transmitted from the table onto their hands. And how they get infected is they would then put their hands on their face. If they put their hands by their mouth, by their nose, or by their eyes, the virus can then move from the hands into them via the mouth, the nose, or the eyes. Most of you would now recognize after hearing this, as in don't touch your eyes, don't touch your face. You would recognize that that is quite a normal response. A lot of us touch our faces all the time. We touch our face all the time. We either dusting off something, rubbing our eyes, thinging our nose. This is a normal thing that we always do, which is why one of the things that we continually tell people is one way to prevent you infecting yourself is one, clearing surfaces around. So if you have the tables, the chair handles, the doorknobs, all of those things, continually clean those, so that even if somebody who has the virus has their droplets on those surfaces, you are cleaning them with like Clorox or Lysol or any of those things. The other thing we tell you is that you need to continually wash your hands, and wash your hands with soap and clean water. It does not matter whether you're using hot water or cold water, as long as you wash your hands long enough and you rinse them with clean water. And after you've rinsed it with clean water, you dry it with a clean paper towel, and you don't use your now clean hands to turn off the pipe, because the pipe head, remember that's the same pipe head you touched when you were turning on the pipe when your hand was dirty. So it means that the virus that was on your hand is now on the pipe head. You also need to remember, so you need to use the paper towel to turn off the pipe head so that you are not touching the pipe head with your clean hands. You also need to use the paper towel to open the door. So let's say you're in a washroom and you've closed your door. Remember, that is the same door that when you came in, you used your dirty hand to close the door. So you now need to use your clean hands. You don't want to use your clean hands to touch the dirty knob anymore. So you're going to use a paper towel to open the door. Ideally, if you are in an office space or wherever, it would be nice to have a little trash can right outside of the door of the washroom, so that when you use the paper towel to open the door, you use the paper towel to turn off the pipe, you use the paper towel to open the door, you then throw out the paper towel right after you've gone through the door. You throw out the paper towel right after you've gone through the door. By the way, I am asking people if you have specific questions to add the questions to the chat, and if I can answer them, I could answer them. If I can't answer them, I can't, unfortunately. I just saw somebody said they're not hearing me. Is that true? Is everyone not hearing me? Are others hearing? All right, so let me answer a couple questions. Let me identify a couple things by the time. One of the things we hear health professionals talking about is isolation and quarantining. Isolation and quarantining. Those are two words that we've been hearing a lot of, and in some instances we use them interchangeably, although they mean different things. Both refer to keeping someone separate from other people, right? Both isolation and quarantining refers to keeping people separate from other people. Isolation, though, refers to keeping somebody who we know is sick away from other people, either within the hospital or within the health sector or whatever. So that is what isolation means. You isolate somebody who you know is sick. Quarantining, though, quarantining is what you do with someone who is not sick yet. You don't know whether they are sick, but because they have been exposed to other people who are sick, it's possible that they may be getting sick, but they have not gotten sick yet. So you quarantine people who are well, but who may have been exposed to whatever it is you're talking about. And we've been hearing people saying you quarantine them for up to 14 days. So what does that 14 days mean? 14 days is the incubation period. 14 days is the incubation period for when, after you've gotten exposed to the virus, that is when you start showing signs and symptoms. So the incubation period is the period between being exposed to whatever it is, the virus, the bacteria. In this case, we're talking about the coronavirus. And in this case, the incubation period, meaning the time that it takes between when you are exposed to when you average start showing signs and symptoms, is 14 days. That is why in many instances they tell you that there are travel restrictions, for example, that say you are not allowed to come into the country less than 14 days after you've been in a place where we have coronavirus, or if they have told you to self-isolate, meaning you are on the island, you are in the country, but you may have been exposed, they tell you to do it for 14 days. Because if after 14 days you are not showing any signs and symptoms, then you don't have a problem. It means that you are not going to get sick. Okay? So that is the isolation versus quarantine and the incubation period. So let me answer. Nyron says, how should one treat with a family member that comes down with the flu? Should they be sent to be tested for COVID-19? So The thing is, we have several other types of flus happening in Trinidad and Tobago and around the world. Flus are a normal thing. As a matter of fact, the CDC has indicated that hundreds of thousands of people have gotten the flu in the US between October last year and February this year. And they estimate that up to about 46,000 people in the US have actually died from the flu in the US between October and February this year, which means the flu is something that is actually very, very common. It's happening all the time. We have swine flu, bird flu, all of those different kinds of flu, and people have been dying for it. The thing with corona though, they usually ask several questions to determine whether you should be tested for corona. Because we know corona started in China, and you have had to have come in contact with somebody who was in China, or somebody who was in contact with somebody who was in China, so passed along and along and along. One of the things they would ask you in Trinidad and Tobago right now is whether you have actually come in contact with somebody, whether you just traveled from China or anywhere else that has it, or whether you have come into contact with somebody else who has traveled, whether China or anywhere else. If you have not come into contact directly, meaning you have not traveled, or you have not come into contact with anybody else who has traveled, then even if you have a flu right now, it is not likely that you have COVID-19, which is the name of the disease that is caused by coronavirus. So they usually use those things to rule out. Another thing that is identified is whether you have a fever, because that is one of the telltale signs of this particular COVID-19, whether you have a fever. So those two things: have you been in contact with, either have you traveled recently, or have you been in contact with somebody who has traveled, and do you have fevers in addition to the other signs and symptoms of a flu? If you have not been in contact with somebody who has traveled and you haven't traveled yourself, even if you have a flu, it may not be COVID-19, and depending on the number of testing kits we have, they may not want to quote-unquote waste a testing kit on you. So that would determine whether you get tested or not. That's one of the things. The government taking necessary precautions from the coronavirus entering Trinidad and Tobago? I think that we are doing a pretty decent job. We have outlined what are known as travel restrictions, meaning we are telling people who come from certain countries that you cannot come into Trinidad and Tobago unless you've been away from those countries for at least 14 days. So right now we have travel restrictions on like China, Singapore, and a couple of those countries. We have travel restrictions from those countries. What they should be doing, and I cannot attest to whether they are actually doing it or not, but what they should be doing is actually having people at the borders, at the plane, the airports and seaports, doing thermal testing to see if you actually have a fever at the time of coming in, looking at you to see if you look sick, because many people who have the flu and are experiencing signs and symptoms actually look sick. So that's one way of just looking at you and saying, okay, you look kind of sick, where did you just come from? And that's the other thing, looking at the immigration forms, the arrival forms that people usually sign when they are coming into the country, to see what country they just came from. And those are ways to help protect our borders. The thing about travel restrictions though is that you cannot tell a citizen of Trinidad and Tobago that they cannot come home. So even if you may have travel restrictions for citizens of other countries, citizens of Trinidad and Tobago would be allowed to come into the country and would then be quarantined if they are not sick, or isolated if they are already sick. Yeah? Let me see what other questions are here. Let me go through. The question says, the droplets that are on surfaces, do they survive longer on hot surfaces or cold surfaces? That is a question I really don't know the answer to, but most of the surfaces that we have are room temperature surfaces. I mean, the door, the table, the handle, all of those things are room temperature. So we know that it's surviving for several hours at room temperature, and most of the surfaces that we touch are room temperature surfaces. So that much I know. I honestly can't tell you how long it survives on hot versus cold. I really don't know the answer to that. If somebody else writes, if there are there any plans for somebody who has it? What's next if they test positive? Okay. So the reality is that if you test positive for COVID-19, there is currently no official standardized approved medication for you. That's the reality. There is also no vaccine to prevent you from getting COVID-19. So the way they tell you, you can go and get a flu shot, a flu vaccine, or you can get vaccines for the other things that we give you vaccines for as a child. There are no corona or COVID-19 vaccines just yet. And it's going to take about a year, maybe a year and a half, to even get to the point where we have vaccines. That hasn't happened yet. There are no standard authorized official, these are the approved treatments for corona or COVID-19 yet either. What they've been doing is the people who have, for example, respiratory illnesses, they do nebulizers and those things to help them with those things. If you have a high fever, they give you medication to control your fever. Those are the kinds of treatments that are currently available. And we do have those treatments in Trinidad and Tobago because we've been dealing with fevers and respiratory illnesses in Trinidad and Tobago. So we should be able to do that. What we need to ensure, though, is that the person who is positive, when being treated at the health facilities, that the workers are well protected. So the workers wear their gloves, they wear their gowns, they wear their mask, and the mask that you wear is dependent on what the patient, what you're doing with the patient. So for example, if you are an orderly and all you are doing is wheeling a patient from one place to the next in the hospital for whatever reason, then you just need to wear one of the regular surgical masks that we buy a dime a dozen. If you are in the room or you are a nurse or another health professional where they are doing nebulizing, where because of the amount of air and because of the procedure, it is more likely that the virus would be in the air spewing out, then they would say that you need to use the N95 mask. So you use a mask when you are with a patient who has COVID-19, but which mask you use depends on what you are doing with the patient. Right? So everyone doesn't need to go around with a COVID-19 mask. As a matter of fact, those COVID-19 masks, they come in different sizes. So you need to be tested for the correct size to ensure you are wearing the correct size mask. When you put it on, there's a particular way you need to put it on. You also need to wear your goggles when you are wearing it. There's a time limit for how long you can wear the N95 mask. It's like 4 or 5 hours. So after that, you kind of have to change, get a new one, depending on what you're doing. Of course, there really shouldn't be any procedure that you're doing that is lasting that long. So that may not be an issue. But I'm particularly telling this because we have a lot of people who have been running out and purchasing masks just because they want to purchase masks and they're trying to find the N95 mask. Now the thing with wearing a mask is, if you are well and you are around well people, there is no reason for you to wear a mask if you follow all of the other procedures like washing your hands, cleaning your surfaces and that kind of thing. If you if if you suspect that you are sick, meaning you started getting signs and symptoms, you're not feeling well, you're starting to sneeze, to cough, and those things, to protect the people around you, you should put on a mask. So that is the regular surgical mask, because you're able to protect, you're trying to protect the people around you. If you are at home and you are taking care of somebody else in your house who is sick, then yes, both you and the person should be wearing a mask when you all are interacting. But other than that, there is no reason for any of us to just be walking around in Trinidad and Tobago with a mask on our face, because we don't have that risk. You see them walking around with masks in China, and particularly in Wuhan, China, because the volume of people who are sick is so high there that they need to do it in public. In Trinidad and Tobago, we are not there, and I hope to God we don't ever get to that point where we need to do that. But for now, we don't need to walk around with these masks like that. Somebody says, what about the boat that came to Tobago? Did they check them? So now that is something that was of interest, because over the weekend I think there were 2 cruise ships. One was supposed to come and we turned them back. We said no, as when by we I mean the government. Told them no, you can't come, because when they looked at the list of passengers, and when they looked at where those passengers came from, and when they looked at the fact that some of those passengers may actually be sick, they said no, you can't come. The other boat, I am assuming that they did the exact same thing, went through that entire checklist, and because that boat did not come from places where people are sick and did not have sick or sickly people on the boat, they allowed them to come off. I am assuming that that is what happens, because that is what should have happened. That is the protocol that is out there. That's the international protocol, part of the international health regulations. That is what you are supposed to do, to allow a ship to come on, allow people to come off of a ship or not. Same thing with a plane is what is really supposed to happen. Again, I am assuming that that is what happened, and I'm hoping that that is what happened when they docked there. Sorry, I can't listen. I am at 3,500 feet. Okay. The person said, do you think that we are properly informed, educated about the virus, and do you think that the Minister of Health not taking this thing that serious? To me, it is that is the way with it. I think that we are slow in responding, and we are now getting to the point where we are providing the correct information to everyone. And I think that is, I'm not sure why that is, but I am almost comforted in the fact that the US is also messing this up ridiculously, unfortunately, with their response. In Tobago specifically, I know that the head of the person who is in charge of the health centers and the person who is in charge of the county medical officer of health's office and so forth, they have been going around systematically talking with people who are in the health services. So the different categories of people, the nurses, the doctors, the people who work with TEMA, the people who do the ambulances, they've been going around to those people, giving the necessary information, explaining how to use the PPEs, when and how, and so forth. So even though that, I think, is slower than we would like, it is happening. And that is the important thing. We can't have too much right now on the fact that it was slow in coming, but the fact is it is happening now, and it means that we are getting up to speed. We are getting to the point where we are preparing ourselves for this. The good thing is that because we are kind of third world still, when the WHO produced testing kits in February, late January and February, Trinidad and Tobago did also get testing kits. Now, I don't think we are able to test in Tobago specifically, but we are able to send our samples to Trinidad. And the last time it happened, I think we got a result within a day. So that's good. So we are able to test in Trinidad and Tobago, and we're able to get the results relatively quickly. What do you recommend as far as traveling? As it relates to traveling, you need to determine your individual risk or the risk of your family. So one, if your travel plans were to go to Wuhan, China, then no, you probably shouldn't do it. If your travel plans were to go to Barbados, then you probably should. If you are over 60 years old, you are diabetic, hypertensive, and have lung issues, then no, you probably shouldn't be going anywhere. But if you are 18, young, and no other medical issues, then maybe so. It might not be a big deal depending on where you're going. Personally, I think that it is a little risky right now doing cruises, only because the cruise ships are such a confined space. Although having been on a cruise in December, I do recognize that they do a whole lot of work to ensure that the cruise itself is clean and sanitized and so forth. But just because of how closely packed everyone is, particularly if you are older or if you are one of those who are in the high-risk group, I would certainly not do a cruise right now. And the good thing about it is a lot of these companies, the cruise companies and even the airlines, they are allowing you to postpone your trip without being penalized the way you would have normally been penalized if you had just canceled your trip. Is it wise to travel to the US at this time? Again, as I said, it depends on who you are and your risks. One thing about the US, as I said, I was actually pretty surprised at how badly the US has been treating with this. One of the things that the US fell down on is, instead of using the WHO approved testing kits for corona, they decided that they were going to make their own. And the first batch of testing kits that they made were not good. They were giving inaccurate results, and they kind of just had to throw them out. They have gotten up to speed though, because I understand this weekend a new batch of the testing kits went out to various health organizations in the US. So they've gotten up to speed with that. Now the thing with testing kits is, now that they have testing kits, it means they are now going to find more people positive. It doesn't mean that they have more people who have corona compared to everywhere else. It just means that they are actually testing people. Once you start testing people, you would find that people have the disease, and you need to take that into account when looking at the sheer numbers. It is actually a good thing to test and to know how many people actually have it, because then you can plan for it, then you can treat with it, then you can do what you need to do. Okay, another thing I wanted to raise was this idea of hand sanitizers. And because I have also seen people posting and people sharing recipes for hand sanitizers, and everybody's going wild purchasing hand sanitizers. Hand sanitizers should be used when you cannot wash your hands with soap and water. Hand sanitizer should be a second or third resort. It should not be your first option. So if you are in your office and you can get up and go wash your hands, do that. Go wash your hands, because that is the best of the options. You only use hand sanitizers if you don't have an option of washing your hand, because the alcohol in the hand sanitizer would kill the virus or the bacteria that is on your hand. So you're killing it but it is better to wash it off and wash it down the drain, for want of a better description. Thing about hand sanitizers too. The alcohol content in the hand sanitizer, so you need to read the bottle. You need to look for the expiration date to make sure that it's not expired, because like everything else, if it's expired, it means it's not going to work as it should. You need to look at the alcohol percentage. It needs to be at least 60, 62. So let's go with a wrong number of 60. The alcohol content of the hand sanitizer needs to be at least 60%. At least 60%. I have seen, again, people talking about making their own hand sanitizers and using vodka and this, that, and the other. If you look at the percentage of the alcohol that is on the shelf for us to drink, you would recognize that most of them do not get up to 60%. And because they are not up to 60%, if you then mix it with anything, then it would not be, the alcohol percentage would not be high enough to kill anything. So please, don't go try making your own hand sanitizer unless you figured out a formula, because you've actually done it in a lab or something, where you ensure that the percentage of alcohol is greater than 6%. Just go buy your hand sanitizer, please. Better yet, wash your hands with soap and water. Bottom line, that is most important. Wash your hands with soap and water. Most important. So again, let me look back at the original post that I had made to see if there are other questions. If you have other questions, post them and I will try to answer. Somebody asked about where to buy hand sanitizers and so forth in bulk, and honestly I don't know. I honestly don't know. No clue where you can buy it in bulk. But then why do you need to buy it in bulk? Maybe I should have asked that question to see what was the reasoning. Let me pull up the Facebook post again. Let me see. Wait, I post so much things already for the day, right? Wait. Any other questions? If there are other questions, you could type them to by the time here we go. Okay, so somebody asked whether we're prepared. Okay, are we prepared? Because we know the deficiencies of our health system, we need to ensure that as individuals we take responsibility for preventing it from coming to you and coming to your family. And that's just the reality of things. I wish I could have said definitively, yes, we are 100% prepared, but the reality is I don't know. I can't say that 100%. That is why I have been stressing that it is your responsibility to try to prevent yourself from getting it. So if you are sick, it is your responsibility also to not spread it. If you are sick, self quarantine, meaning self-isolate, meaning stay home if the symptoms are not that bad. Stay home, you could get over it on your own. Continue drinking your, I don't know, Zeva Pippin, can I say bush rum? Or whatever else, if the symptoms are not that severe. If they are really severe, then definitely call a health facility. Oh yeah, while I'm on that, if your symptoms are severe and you think that you need to get medical treatment, because again, if you're having respiratory issues, you're not breathing properly, you're finding it difficult to breathe and that kind of thing, then you definitely need to get to a health facility. What you need to do though is contact the health facility and tell them this is what's happening and they could advise you. If it is that you need an ambulance, tell them when you are calling the ambulance that you are calling because you suspect you have COVID-19. That way they would send a specific ambulance for you. I think we have a couple of them specifically identified in Tobago to send, and then the ambulance people would then be required to call the hospital ahead of time, because if this is the situation, when you go into accident and emergency, they would not want you going into accident and emergency where everyone else is. And there is a specific place that has been identified in accident and emergency to take people who they suspect have COVID-19 that is separate from in the main area where everyone else goes. So it's important to call and find out what is the procedure first before going. If push comes to absolute shove and you drive yourself up there, you can't get an ambulance, or you say, I just not feeling well, somebody come and take me up. Ensure that if there's somebody with you, if they have masks, let them put on the mask. You put on your mask, and when you get there, let them know immediately this is why you are here, so that they can deal with you outside of normally just sitting down outside with everybody. Let them know. Somebody said here in New York you cannot find any hand sanitizers, and it seems like the same thing is happening in Toronto. You can't find any hand sanitizers, which means you all need to go back to the wash your hands. Try your best, even if it means walking with a bottle of water, so that you can use the bottle of water to wash your hands. If you're in that kind of situation, then do that. That is what you have to do. I think I would post a link in the description so you could come back to it, where they looked at, there was a teacher who had her class do a little experiment where they had a slice of bread, and they washed their hands or touched the bread. They used hand sanitizer, touched the bread. They just left the bread without anyone touching it, and left it to grow the molds and to grow the stuff that is on it. And they recognized that the bread that no one touched, of course, stayed pretty decent after a while. But the one that had the hand sanitizer, that actually still grew quite a bit of ooey germs. But the one where the students washed their hands properly, that one was actually pretty well preserved, showing that the washing their hands is actually better than doing hand sanitizer. So again, hand sanitizer is a last resort. Keep washing your hands. You should actually be complaining about your hands getting chaffed and your hands getting dry because you're washing your hands so often. And by the way, when it comes to washing your hands, it's something that you need to do the right way. What is the right way? Much longer than you've been doing it. What is one way that is recommended to determine whether you are washing your hands long enough is to sing the happy birthday song twice. So you have your hands soaked, you're washing it like this, and you're singing happy birthday. You are washing so you can get the back of it, getting the back, getting the inner part. But you must also remember that your fingertips also carry germs, so you need to do this part of it to ensure that you get your fingertips cleaned. And of course, you have your thumbs, so you need to also do this to ensure that you clean your thumbs. Do inside your nails and wash, 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 wash. You should be getting tired of washing. You should also recognize now that we have not been washing our hands correctly all this time, which is why we would see so many cases of the other kinds of flu. I am sure after this, we are going to have a reduction in foodborne illnesses. We're going to have a reduction in so many other things because we finally, as a world, have started washing our hands correctly. And this is something, because somebody else also wrote that it is something that we need to include in our schools, because we need to teach our children, particularly that happy birthday to you song. Teach your child to sing that while they are washing their hands. The Division of Education, if you are in Tobago, is responsible for providing hand soap and that kind of stuff. If they are not doing it, if your child's school doesn't have the soap, you need to take responsibility as an adult to ensure that your child has soap to wash your hands. Because after they get sick, you can't blame the division for that. Yes, you could blame them, but that doesn't help. Now, talking about children, it's coincidental though that we have not seen a lot of children getting sick, and even the children who have gotten sick have not gotten very severe illnesses. And as far as I am aware, we haven't had a single death of a child from COVID-19. So thank God. We don't know why, we're not sure what it is that is protecting the children of this world, but I am just thankful that the children are not getting sick. We also tend to see that people of African descent seem to not be getting as sick as others. Again, I don't know what is it about this melanin, but thank you, Lord, that we have not been getting as sick as some of the other races. Again, we are not sure. That doesn't mean that you get to be complacent. That doesn't mean that you get to say, well, I ain't washing my hand and I ain't doing this and I ain't doing the other. No, you still need to be concerned and you still need to act. But it seems like we have some kind of protective thing about us that we are eternally thankful for. Let me go through again. Okay, somebody says, if I as a parent develop a fever and I am at home, what do I do? Do I take everyone to the hospital for testing or go alone? So it depends on what else is happening. If you are the only ones exhibiting signs and symptoms, so you are the only one who has a fever, is coughing, sneezing, whatever, then you go. But you also have to be conscious of the fact that you need to protect your family. So for now, because we don't have a whole lot of testing kits just sitting around waiting, doing nothing, it may not be wise for them to test all 10 of you. It may not be wise for them to test all 10 of you, but you definitely need to be tested, and you definitely need to ensure that you do all that you can to protect the other members of your family. That would be a situation where I would suggest calling and talking to a health professional and asking them, because again, it depends on who else is in your family. If your family also includes grandparents who are very sick, then the answer to that may be very different compared to if your family includes other 20-year-olds who are all fine, right? So, any other questions before I wrap up? Any other questions? Let me make sure I haven't missed anything. Again, I figured that in the midst of everything that was happening, that we needed to just get an opportunity to ask questions, get an opportunity to go through some of the things that's been bothering us, and we go from there. Again, we reiterate, yes, you need to be concerned, but do not panic. Panic causes people to not act and to act foolishly. Concern causes people to respond appropriately, and that is what we need you to do. Respond appropriately. Ensure that you wash your hands. I know I am supposed to be a decent, respectable professional. Wash your damn hands. Wash your hands. That is the key, because we recognize that something as simple as washing your hands all the time. Okay, one other thing before I go. We are very much a hug and kiss up and shake hands culture. Let's just not do that for some time. Let's just not do that. So we're not shaking hands with anybody. We could do an elbow bump, we could do a bottom bump, we could do a something, anything, but we're not shaking hands with anybody. Doesn't matter who they are, unless as soon as you finish shake their hand, you're running to go and wash your hands. So let us not shake hands right now, because again, you don't know if they just sneezed. You don't know if they just sneezed into their hands, or they just coughed into their hands, or if they just touched a surface that has COVID. You don't know that. So you don't want to put yourself at additional risk. So let's just not shake hands for now. We can go back to it a little later, but just now, let us just stop shaking people's hands. Okay? So if there are no other questions, I think that's it. Go back, share the live so that other people could learn a little bit. If I get additional questions on my Facebook page or on my or in my inbox, then I may do another live at another time. Oh, not even elbow bump, no touching. Well, okay, let me respond to that. It's not likely that we are going to use our elbows to touch our face. So when it comes to COVID-19, there is still some protection as it relates to using your elbow instead of everything. That's why we say an elbow bump. Yeah, that's why it's an elbow bump. It's okay. It's better than using your hand. But if you are OCD, if you you don't want anybody touching, then no. Just say, hey, how you going? Nice seeing you, and continue having your conversation. So okay, that's it. Hope you all learned from this. Hope you all enjoyed it. Hope I was able to provide some information, and we go from there. Again, let's not panic. Let's be prepared. Let's not panic. Let's be concerned. Let's not panic. All right. See you.